On behalf of everyone here at Mercy, we want to thank you for exploring our graduate medical education program. Here at Mercy, we proudly train more than 100 residents annually in 4 different residency programs. Our residencies are closely associated with 2 local medical schools, and we combine the academic rigor that you'd expect with the personal touch and feel of a community teaching hospital.
Mercy Catholic Medical Center traces its history back to 1861, when the Sisters of Mercy arrived in Philadelphia and began their ministry. Our initial hospital, Mercy Philadelphia, was opened in the then urban farmland of West Philadelphia in 1918. Mercy Fitzgerald Campus opened in 1933 and has been training residents since 1936. Over our almost 90 years of service to our community, we have been innovators, including the first suburban Philadelphia hospital to offer open heart surgery, the first hospital in our region to introduce a hospital-administered home care program, and the first to provide paramedic services. Today, Mercy Catholic Medical Center is proud to continue the traditions of the Sisters of Mercy in caring for the poor, needy, and sick. We are a busy safety net hospital serving the communities of Southwest Philadelphia and inner suburbs of Northeast Delaware County. Our hospitals have 16,000 admissions and more than 200,000 outpatient encounters annually. We are certified by national organizations for our care in stroke center, breast cancer treatment, advanced cardiac care, bariatric surgery, and wound care. Our busy outpatient offices, emergency departments, and inpatient hospitals provide advanced, patient-centered care to our community. We are proud to earn an A from the Leapfrog Group for hospital safety and to be the best hospital in Delaware County according to the Delaware County Daily Times.
What brought me here was a job, but what keeps me here is really the sense of community, both the people that I work with as well as the patients and families that we take care of.
I know the impact, the positive impact we've had in this community. I know it through people that stop me, patients, and says, Mercy saved my life. I was somewhere else and I was just a number.
There's that sense of service to the community, and it's not just a business that is run here.
I came to Mercy hoping to be able to be a part of Catherine McCauley's dream of serving the sick and the poor. And I stayed because of the beautiful ministry that I saw happening every day through our colleagues' hands.
It was important to me to work at an organization that aligned with who I am as a person and my personal values. The mission here to serve all people, regardless of who they are, where they came from, was really appealing to me.
Mercy Catholic Medical Center is proud to serve our community and be the primary hospital for so many patients. Our combination of excellent physicians and advanced technology, including some of the most advanced CT and MRI scanners in all of Delaware County, means that we rarely transfer patients to tertiary hospitals for ongoing care.
We have such a high volume of complex operative pathology here. That's sort of unique for a small community program.
Medicine is all about teamwork, right? Most of the nurses, the techs around have been here for so long. So being a beginner, like when you come into residency, they're able to know things and let you know hey, do you want to come check this person out?
One of the biggest benefits is that you know your colleagues really well. And I feel like that helps in overall patient care because we all work together as a team.
It's easy for a junior, for a resident to be an integral part of decision making and part of the patient's full care.
It's actually a blend of the amount of supervision that you get and the independence of practicing and executing your plans.
It's not just go do this, go do that, but we're part of it. They're our patients. We get the opportunity to have full ownership over them, and so that is fulfilling.
There's a lot of variety in the cases that we see because we serve the underserved population.
It's a special place to train where you learn not only the bread and butter about medicine, but you also learn how to take care of underprivileged, disenfranchised. You learn a lot about humanity, and on top of the basic sciences and the basic clinical skills.
Mercy Catholic Medical Center hosts 4 different residencies: internal medicine, diagnostic radiology, general surgery, and transitional year. They are supplemented by visiting residents in emergency medicine, urology, and orthopedics, as well as medical students from Drexel University College of Medicine and Philadelphia College of Osteopathic Medicine. Our residencies build on more than 8 decades of medical education to allow residents to become fully trained for osteopathic or allopathic boards, as well as challenging subspecialty fellowships.
I've worked here since 2011, first as a resident, and then I went on to do my fellowship at Penn, and then decided to come back here as faculty, so it's been a good experience.
I feel really supported in terms of letting me get to experience different parts of medicine, the different subspecialties, inpatient, outpatient.
For a smaller program, we produce a lot of academic material. A lot of our residents publish multiple papers before they pass out, and that helps them get into better fellowships.
Even aside of the walls of medicine, they give you some advice that you would really learn to, in terms of fellowship, in terms of places to look out to, in terms of job search and all that.
You get one-on-one teaching with the attendings, you don't have fellows taking your cases, and you still get ample opportunity to participate in research projects and exhibits, IRB-approved research projects that you can send to major conferences and build up your CV right from the beginning. That combined with the friendly and family atmosphere in a community hospital setting gives you the best of both worlds, I think.
Mercy's clinical learning environment, combined with its location in suburban Philadelphia, allows residents to balance their education, work, and personal lives. Our residents graduate prepared for challenges of fellowship or independent practice.
You come here because there's a family atmosphere here that you're not going to get anywhere else. People here truly know each other, and that's regardless of whether you're a resident, a food service associate, or a nurse on the floor.
When I first interviewed here for the residency, the feeling that I got was I was at home.
At every point, if you want to hang out, outside of the work environment, it's also, you can easily hey, what are you doing this weekend? Can we do this? It's so much fun to be here, both in academically and out. You can have fun.
I live 5 minutes down the street in Lansdowne, but it puts me about 25 minutes from Center City. I call it the best of both worlds because I can get to work on time, and I can also, it's not a huge trek to go downtown and have go to a bar with friends or whatever.
If you come to Mercy, you will find everything you need, not just academic. You are smart. You will be here no matter where you go. You will learn what you have to learn. Mercy will add another things to your residency that later you will appreciate a lot more. The sense of friendship, family, and you'll enjoy working day to day with all the staff and faculty.
I think when I look at residency, it's a very privileged journey, and it's a unique journey as well. And the best part is that I get to share that with my co-residents. There's a huge diversity in terms of where we all come from, and I see them not only as co-workers but friends.
I would seriously consider Mercy as the stepping stone or the ending point of your training because of the individualized education that you receive and because of the opportunities to participate in care of a wide variety of patients from urban and suburban settings and truly have that individualized attending attention to your educational needs.
It's the ability to train the next generation of leaders. It's the ability to do research and have an academic impact in the field of medicine. It doesn't get any better. And the ability to do this at the community hospital and to use these tools to take care of our patients, it really makes you feel good.
Thank you for visiting with us today. We're proud of the clinical learning environment we've created here at Mercy and invite you to explore the details of our residencies on this website.